We'll start with today's session. So I welcome you all on the final day and the seventh day of our international webinar on challenges and trepidations of nursing professionals globally during current pandemic COVID-19. I'll be the moderator for today, and I heartily welcome our distinguished guest for today, Miss Ginny Verghese. She is the nursing officer and team leader of respiratory ICU in Safdarjung Hospital. She has done her BSc Honors Nursing from College of Nursing Safdarjung Hospital, and she has total experience of 5 years of clinical practice, and she's holding license for ACLS BLS from AHA. She has 1 year of experience as trainer with Vivo Healthcare and 1 year of experience as a nurse at Ayush department. So I heartily welcome Miss Ginny Verghese, and she'll be taking today. The lecture will be on the how to survive the current pandemic. She'll be dealing with today's lecture. So I over to you, Miss Ginny Verghese.
Thank you, ma'am. Thank you so much for having me here. My name is Ginny P. Burgess. I hope all of you are well and are safe. I'm here before you today to discuss upon an important topic that is very untold, but very important issue as concerned to nursing. That is the global effect of the pandemic COVID-19 on nurses. COVID-19 has become a terrible nightmare for the entire world by this time. A tiny virus originated in a wet market at the Wuhan city of China has now entered into all of our lives and has become an inseparable part. Though this pandemic has not spared any one group of people who stand still and wonder for how long will they have to fight this, for how long will they have to go through this. They are the people belonging to healthcare sector. When we talk about healthcare, nurses are the backbone. They are the main stem. Time in and time out nowadays, we come across a lot of discussions, long debates, which have really spiked up the TRPs of a lot of new channels. They discuss about healthcare system, the increasing death rates, the mismanagement in the hospital systems, but very rarely they discuss a topic, that is the pressure which is put upon on the nurses because of this pandemic. Now, why is this pressure? Why is this unnecessary hodgepodge? Are we not experienced? Have we not ever worked in a hospital setup? Yes, we have. But here the situation is different. The working hours, the change in the departments, donning of PPEs for a continuous 12-hour shift, mingling up with a new team in a new department, all of this creates an immense amount of untold difficulty that is innate, that is never being told. No one is ever coming across such a situation daily. The actual struggle starts or begins from the very day a nurse comes to know that he or she is posted into a COVID care unit. I myself has recovered from a recent episode of such emotional cyclone of COVID-19. This tiny spiky virus has really spiked up a lot of emotions within us all, I'm sure. Anxiety of anticipation, anger, irritability, insomnia, depression, all of this has entered into our lives. As nurses, we face this very badly. The American Medical Association has conducted a recent study amongst 1,254 nurses of around 34 hospitals in China, and the results which they have got is not at all comforting. Around a data of an eminent percentage of them have reported signs and symptoms of depression. Another group of people with around, excuse me please, 34% of them have reported signs of insomnia. 72% of them have reported distress. All this is gone every day. All this is because of the burnout and moral injury that is faced every day. And what is this burnout about? It is because of the continuous workload that is increasing because of a rise in the spike of COVID cases. And why is this moral injury? What is it about? This is because even though we work hard on the front line to provide quality care to the patients for a 12-hour period, we are not satisfied. Why? Because most of the COVID care setups have recently been set up owing to the increase in the cases. And as a staff, you have been posted there. You have to get adjusted to the new situations. You have to arrange all the necessary things by yourself. Though the hospital administration and government is trying their hard to provide all the facilities, still there is scarcity of resources, scarcity of manpower, the lack of essential items like sanitizers, surgical gowns. All of this can cause certain drawbacks, certain hosh-posh here and there that won't allow you to do your duties perfectly sometimes. That will create an innate guilt. I have been through several instances of such guilt. For example, in a COVID care setup, in an ICU basically, you have 3 nursing staffs, 3 doctors, two of your nursing attendants, 2 to 3 of your BVG workers. That's a team. And a team leader, of course. That's a team. You have gone and you have entered the ICU. All others, and you have a doctor, one of a nursing attendant inside, and all of others are managing the work outside. When you have gone inside, you have seen that a patient who was admitted early, he was all well, he was on an oxygen mask, but now the heart rate is 0. You ran to the bed. You try to save the patient. You try and call the doctor. You try all the necessary revival precautions. Give him atropine, adrenaline, but that patient could not be saved. You have that guilt that in spite of having all those ICU precautions in front of you, a life could not be saved. A dead body, after a patient expires, the death is being declared to the patient relative, a dead body is on the bed. But as the media shows it off, it is not actually your fault that it takes longer hours for the dead body to be packed, to be handed over to the ambulance, and to be transported to the morgue. That is not exactly your fault, but it happens so because of such a situation being created. Because 2 of your nurses assistants have been gone for a variety of works like managing the stock, getting the stock from the main store, or they have gone to give the samples to the main lab, and you are alone there to pack the dead body, and you are alone there to give the drugs to the remaining 15 patients who are at your ICU setup. So it takes some time. Meanwhile, if you are outside, if your friend is inside the ICU, you are outside on the dust, you get a lot of calls from the patient's relatives saying that they're pleading literally to give them the bodies of their relatives. That immense amount of guilt inside your heart, that maybe 1%, it is because of a carelessness from my part that this might have happened. I'm not able to do anything for this patient's relatives. Can you imagine? Can you imagine the kind of stress they're going through? Just a few hours before, the patient is being admitted to the COVID setup, and now he or she is no more. And that news is being received on a phone. And they will have to wait for another 2 to 3 days to receive the body, only if that body is COVID negative. Otherwise, they won't get to see that body even ever. That kind of a guilt is going to haunt you even when you are on your bed at your quarantine facility. That is really depressing. But then you have to go through all of this. You have to survive this, because if you are fit mentally, you are fit physically, then only you will be able to manage the further quality care of your patients who are in need. There are some common stress reactions that we all go through nowadays. Basically, anxiety. I felt all this 14 days of my COVID posting that I have palpitations. There is a constant storm of emotions that is going on in my mind. Even when I do a particular thing, in the initial 1 or 2 days I'm talking about, I felt like I have too many things to do. There's a lot more pending. I have to do a lot more things one after the other. But that should not happen. That will aggravate the stress. That will aggravate your fear. You won't be able to complete even one task properly. The other signs include feeling pressurized, rapid shifting of emotion, your mood swings, anger, irritability, difficulty in concentrating, feeling mentally overwhelmed, insufficient personal energy or capacity to implement basic self-care needs. When you are at work, you will forget that you are feeling thirsty. You have to have some food. You even forget that because you're really busy with your work. Patient care is not only the work you are even responsible for coordinating the all the necessary stock related items. Even a piece of paper at the counter is your responsibility. Arranging for the stocks that have perished during your shift hours from other departments. Everything goes hand in hand. That creates an immense amount of pressure deep within. That makes you forget all of the things. I felt like as if I am being posted into a clinical setting for the first time. I even forgot how to write the report of a patient properly. All the documentation should be perfect. Not even a dot should be missing. And all this is creating, and you are at a gunpoint because of all these things. They can be behavioral as well as physical symptoms as well. Sleeping less, eating less, avoiding certain people, and some people even revert to negative coping habits like drinking and smoking, thinking that that would reduce the stress. Headaches, physical weakness, dizziness, muscle tensions, stomach upsets. You go through all this daily. But even when you are going through all these things, you need to keep a hold on yourself. You need to keep on motivating yourself that this is going to end. What purpose? What I'm responsible for? Why am I posted here? I should take care of those who are suffering more than me. I need to take care of them properly. See, we cannot control everything that is going around. We cannot control everything. What we can control is our emotions, ourselves. We all are capable of doing it perfectly. We all can survive through this. But it's just a mind game that need to be remembered. What are the common challenges we face? The challenges are basically related to the surge in care demands. With the increasing number of cases, there is an increase in the number of patients admitted that will put up a pressure on the healthcare system to provide more and more beds, more and more materialistic supplies so that the patient's care is properly be done. There is scarcity of resources. There is scarcity of manpower because of increased rate of infection within the staff members. That is putting an immense pressure upon those who are currently at work. Reducing the number of team members is very challenging. The equipment challenges. Equipment challenges basically is related to, as far as I am concerned, it is related to donning of the hazmat suits, wearing of the N95 mask, 20, all those 12 hours. It is very difficult to perform even simple things like a venous catheterization, a Foley's catheterization, or even turning a patient who is on ventilator. It is very difficult. In a normal care setting, if a patient is admitted to an ICU, The initial 3 to 4 hours of a day is spent on the basic care of a ventilator patient, like maintaining the personal hygiene care, taking care of the VAP bundle, CLEPSI bundle, COTI bundle, prevention of pressure sores. All those measures have to be carried out. But if you are a team of only 3 nurses, how are you going to do it for all of those patients, all of those 15 patients admitted to the ICU? You don't have that heart to run away from the work, but you are limited. You are restrained because you have to do a lot of things. You have to prioritize your care according to the needs of the patient. But when you are limited by your resources, like donning that PPE, sweating it out, you are not able to carry out your works properly. Providing support as well as medical care. That medical care lag is a 0.5% there, definitely. I'm not ashamed to say this. That is not intentional, it happens. And that creates a guilt, that creates a shame within, that I did not wipe the face of my patient by coming back from the ICU. Trust me, it really hurts. It really hurts when you see a patient struggling to go to the washroom by self. You are there inside, you have asked that patient to wait, but he is not ready to wait. Meanwhile, you are just replacing the inotropes of another patient who is on ventilator, who is more sick than the other patient, who has demanded your attendance to the washroom. But you are helpless there. That creates a guilt. Changing the department and work pattern of the nurses. When a nurse is being shifted from one department to the other, it is altogether a new feeling to get adjusted to the new people, to work with the new team members. The psychological stress which is going on in the outbreak settings is not only because of the staff shortage or the scarcity of resources, that is also because of the problems faced by the patients themselves. We cannot even imagine how anxious they are. That anxiety carry forward onto you as well. The pressure surge happens also because of the media involvement. They keep on pointing about what are the drawbacks there in the healthcare system, but they are never really concerned about what is actually going on. What is the drawbacks that the nurses are facing actually? It is not humanly possible to work 24 hours continuously without taking any rest with a limited number of people that need to be understood. It is better not to focus upon their conclusions. What we can do is that we can put up 100% of our effort to give proper care to our patients. We should not be bothered about the surroundings. We should not be bothered about what is going on in the minds of the other outsiders. The fear of transmitting the virus to family and others is, I think, 80% of the cause of the psychological stress. We should not be afraid. We all have at least the necessary equipments like hazmat suit and N95 masks, a face shield for at least one shift. Then why are we bothered? We should wear it properly, take all the necessary precautions like frequent use of sanitizers, proper hand hygiene, proper and safe donning and doffing of your PPE. That should be done. And then there will be no fear. Rapidly expanding workload. Rapidly expanding workload can't be abolished within 1 day or two. Workload will be there, your stress will be more, your physical burnout will be more, but you should try your best and should complete your task timely. Incidence of hostility and even aggression towards the medical personnel has increased nowadays. This is basically because of the low understanding about the inside causes, what is happening inside a COVID care setup. Maybe a patient's death is caused due to cardiac arrest, not exactly due to COVID. But that is not understood by the patient's family or outsiders who are standing outside the COVID care setup. If you give the news about the demise of a family member to his or her relatives, they may be angered. They may create a ruckus. They may even create a ruckus of not handing over the dead bodies. not understanding the fact that if the body for a percent test positive for COVID-19, that will be very risky factor for the community. And hereby, the hospital protocol is designed in such a way that the bodies will be handed over only after the body is tested negative. But they would understand that, and you are again in a turmoil of emotions while making them understand. Getting into an argument is very common in a COVID care setup. You're actually not avoiding those situations very easily because everyone is irritated, everyone is there in a mood of anger, but that should be avoided. What are some of the dilemmas that a nurse is facing? That is basically related to care of unwell patients. That, as I've already explained about it, the triaging of the patients is very important because what comes first has to be done first. Accordingly, you need to manage the care of the patients inside. Allocation of the resources. In a team, there are not only nurses, doctors, or the nursing assistants that requires N95 masks or sanitizers. The security guards outside your department will also be required with all these things. But if you already lack the resources, your TL has handed over a certain amount of stock to you for the whole day, but that is not, you feel that is not enough for you. And the other persons, outsiders, come and ask for all those supplies for themselves, you say a no. And you dare say a no. They'll start all the arguments in this world. And you will again have to waste your time to decide whom you have to hand over the resources and whom not. That's really very difficult. Balancing your physical needs as well as the patient care needs. That is very important. You should not avoid your own physical needs in between caring for the patients. You should definitely take care of your basic needs like drinking water, going to the loo, taking food timely. That is very much essential. But that decision making itself is very difficult. Aligning patient's needs with family. Aligning patient needs is very, very important. That is because in a COVID care setup, the patient's relatives are not allowed because of the risk of transmission of infection. So it is very important that you have to bear their concerns. You might get a lot of calls on the counter regarding inquiries of the patient's status. Why, how, when. But you'll have to deal with all of it very calmly. There are several factors that affect the recovery from this kind of stress. That includes a sense of safety, calming, connect, self-efficacy, and hope. Hope being the most effective of the factor. You always need to have a hope that you will pass through this. You will face this with strength. Otherwise, you can't go through this. You'll have that immense amount of stress within yourself each day, thinking that how will manage that? How will I manage this? Because each day is a new challenge. Each day is a new problematic day. But all that needs to be dealt with a smile. There are several ways of coping with these stressors. Each of these ways is individualized. Person to person deal with a traumatic situation in his or her own ways. It is not possible for anybody to take this coping strategies as medicinal pills. This comes from the inner core. This comes as an inner strategy. Some people face the situations with a smile. Some might express anger. Some might be in stress always. But that depends from individual to individual. But coping is very essential. Otherwise, you yourself will be into big depression. How is self-care important? Self-care is very much important for you to build that power within yourself to survive through this pandemic. And for that, connection and social support is very much important. Connection with your team colleagues, your team leader, as well as connection with your loved one. Because only if you share your problems with people, then only you'll come to find out a solution. The connection with team is very much important because a team of nurses, as well as a team leader is very much important for you to go hand in hand. I personally was blessed with a good team member, with good team leader, good team members who are very cooperating. That helped me a lot to go through the stress. Anxiety management and self-soothing. That again depends on individuals. We can find many ways to relax ourselves. We should take breaks in between. We should relax our mood by doing all those things which we like. Even that includes munching of a chocolate. Physical safety. Physical safety includes basically here taking all the necessary precautions to prevent yourself from getting infected. Even when you sit with your colleagues, your team members, you need to be properly protected by wearing an N95 mask, frequent use of sanitizers, keeping social distancing from each of them. This is very necessary because as healthcare workers, we ourselves are not immune to this kind of a pandemic. Everybody is at risk. So we need to be properly safe. Focus on what you can control. You cannot control the rising graph. What you can control is your daily activities, your daily shift. You have to put your 100% without any hindrance, all for that 12-hour shift. Therapy or counseling. That becomes necessary when you feel that your anxiety levels are increasing, you have signs of depression within you because of the lack of the family support or so. You have to definitely consult a qualified psychologist. Attempts to find positive alternatives to negative coping. As I've already discussed, some people might revert to drinking, smoking, such addictive habits, thinking that that will help in relieving stress within themselves.
Excuse me, Miss Jenny, can you tell which slide to show? Like which slide you are reading?
Ma'am, it's a
Slide number?
self care slide, slide number 12.
You can tell me when to change.
Okay.
Okay. Yeah. Fine. This is the one, self-care, right?
Yeah, ma'am.
Okay. Okay. It will be easy for the participants to grasp, right?
Yeah.
Because I am not well versed with your slides.
Okay, ma'am.
Okay. You can tell me just the next slide. I will be changing. I'll keep changing
Okay.
when you move to the next slide. Yeah. Thank you.
Okay.
Sorry.
Yeah, it's okay. Uh, I was discussing about therapy or counseling. We definitely need to consult a therapist if we feel that we are going through anxiety or signs of depression. Training and supervision. Training and supervision it becomes necessary if you're being posted into a new department which you are not aware about. Because of the lack of the manpower, you are being shifted to different departments, and training becomes very essential. Under the supervision of your team leader or your colleagues, you need to be well oriented to the new care setup. That will reduce the anxiety levels to a great extent and will help you to work easily. Attempt to find positive alternatives to negative coping. Some people will revert to drinking, smoking habits, but they might find it very relaxing for an hour or so, but that is going to aggravate the problems furthermore. So it is better to find out simple ways to relax yourself, which may even include listening to music for even 5 minutes. That would do the best. Have realistic expectations. You cannot expect that if one day is stressful, the other will be less stressful, or you will become used to it. Each day is a new beginning. Each day will bring you new challenges. You have to face it all. You have to go through it all because that is why you are here to take care of the patients. And while doing that, you'll have to face many hindrances. Have balance. You have to prioritize your needs as well as the patient care needs. If you feel that you are at risk for something, for example, for a nurse who is there inside an ICU, you have to turn an obese patient by yourself. You won't be able to do that. You'll be risking yourself as well as the patient. That is, you have to prioritize that. If you receive the help of an attendant only, then you'll be doing that task. You have to prioritize it according to the situation. Ma'am, please can you change the slide now? There are some self-care obstacles which are attitudinal. This attitude come from within us only. You might feel that if I go for a break, for drinking some water or having my lunch, what will my teammates feel? All others are busy. They have done and they have gone inside, but I'm feeling hungry. But they will definitely feel bad if I go and eat alone. All of them are busy. Then how can I go back? I have to do this. I have to perfectly finish all of my work before the next shift starts. That doesn't mean you need to work continuously. You have your own limitations. You are a human by yourself. You need to maintain this and work accordingly. The next slide is about supporting team care. Teamwork here becomes very important for the fact that you alone are not working for the patient. Your team members are also there. Proper coordination is very important amongst you. You need to shift the number of working hours so that there won't be any burden for anybody. If each one of you are sharing equal hours of work, equal amount of responsibilities accordingly, there will be helping hands and there will be easifying your task. It is very important that a team leader of the team is handing over all the responsibilities to individualized persons properly. And if he or she notices any signs of anxiety or depression or anger or irritability or any kind of problem amongst any of the team members, that particular team member needs to be counseled. It becomes very important for proper counseling and orientation of a particular person if he or she is anxious. There are a number of programs being run by institutions nowadays, like counseling programs, peer support programs, rehabilitation programs, meditation programs for the staff members also. It is very essential that before a COVID posting is started, every staff should have proper orientation regarding what to expect in a setting so that he or she will be mentally prepared to handle the situations effectively. The next slide, please. This is about the strategies for sustaining nurses' well-being. Meet basic needs. Basic needs include eating, drinking, and sleeping. If your body is fit, then only your mind will be healthy. You have to be really strong to survive through this. For that, timely eating of healthy diets, proper sleep for all those 12 hours in between all those anxious thoughts within you becomes very important. And most importantly, while at work, you need to go to washrooms timely. You cannot ignore your nature's call. That will create a lot of discomfort when you are at work. So kindly listen to the nature's call on time. Take breaks. You need to take break whenever possible, whenever you get time while at work. But at work it is actually not possible. You can just take break for your lunches or tea time breaks. But when you are at your quarantine facility, it is very essential that you have to take break from all those things. Cut off from all those posh. Taking all the necessary precautions, you can go out into a garden, sit quietly amidst nature, meditate for some time. You need not to hibernate yourself. You can even have a close discussion with your colleagues who are staying with you at your quarantine facility, but maintaining, of course, needed social distance. Connect with colleagues is very important. Communicate constructively. If you feel that there is something lack back in your team, you have to discuss it very effectively. There's no need to fight. You are different, your colleagues are different, your patients are different, everybody is different from one another. But you need to actually discuss the things. Then only it will be possible for you to find out a proper solution. Contact your family members. We are actually very blessed at this era that we have all the technologies available to interact with our family members, even though we stay away from them. It is very difficult to leave your family, your children, particularly for a female. Stay away from your children, your family, all these family related things. But you have to be strong. You need to connect with them. You can daily call them again and again. Discuss your concerns, hear from them. That will really motivate you. Respect the differences amongst yourself. Very well, you have to go hand in hand with everybody. Within your team, you might have your uh, subordinates who won't understand or who are willing to work, but the fear of contracting the infections might hinder their working abilities. But you have to counsel everybody. You have to go hand in hand and make them understand that each one of you counts. Everyone's effort is very important to provide quality care to the patients. Stay updated. Basically, we have to find out the going on improvements in the healthcare setups regarding the COVID cares, the invention of new medicines, vaccines, but it should be from a reliable source. Don't go after the spiky graphs or the baseless discussions on the inability of the healthcare providers to provide the care. You just need to ignore all of them and perform your duties. Limit media exposure is very important for your mental peace because they talk all those stuffs that is very unrelated. Our last slide includes self-check-ins. If you find that your anxiety levels are not going down, you need to vent it out with somebody who can actually guide you. Let it be a psychologist. There's no shame for that. You need to be mentally fit. You need to go through this effectively so that you can handle your work, yourself, and your family. Honor your service. Most importantly, you have to remember for what purpose you are into this profession. Even the WHO says that as a healthcare provider, it is very normal to feel anxious, to feel worried, to feel stressed out. But that should not stop you from doing your work properly. That should not hinder your ability to provide proper care to the patients. I hope this pandemic would end soon. I hope there is a solution that is coming in very soon. See, we cannot control the waves, but definitely we can learn surfing. As a respected Florence Nightingale, very little can be of fear. We can do a lot for the upliftment and for the betterment of people who are suffering more than us. I hope this session would have helped out you in a bit of way so that you can relax yourself. It is very normal for a human being to feel so in such a situation. But we need to handle yourself. We need to uplift our souls. Meditation, relaxation techniques, yoga, or even silent prayer for 5 minutes would help you out. God is watching you all, or for all the noble causes you are doing. We all nurses are strong. We are angels. We need to just remember this and move forward. Be strong. Uh, I hope there are some questions regarding this.
Yeah. So this is it. Yeah. So thank you a lot for patiently explaining each and every point. And I hope now the participants, they will be well versed how they have to survive this COVID times and how they have to be psychologically prepared and manage their self and their families also. So any question from the participants, they can directly also ask and we will have a look at the chat also. Any question you can post on the chat box or you can ask the speaker directly. Just unmute your mic and you can ask the question. Miss Ginny is working in reception. respiratory ICU, and she's, as she has already told, she's a team leader and she's dealing with the patients with COVID, and how she's managing her team and how she's dealing with the stress. You can just ask her to narrate the experiences. Whatever you want to ask, you can ask from the speaker. So there's a question. There are a lot of anxiety and stress while treating COVID-19 positive person. How to get overcome from it? So how to like the stress and the anxiety while treating?
Uh, as I can see, Saurabh Chakravarti is concerned about direct patient care. Saurabh, I have gone through the same for the initial 1 or 2 days very badly. I was on my first day. I was even afraid to look at the patient side. Trust me, but this should not happen. They are human beings. Consider them as a member of your family. Just see the patient on that bed, a female or male, as your family member. And if he or she is suffering the same way as that patient is suffering, will you be able to stand behind? The fear of contracting infection, the COVID-19, is basically stopping everybody from engaging or putting up the 100% effort. You put now maybe putting a 95%. That 5% is lagging back because of this fear only. Don't be afraid of such things. Wearing all your hazmat suits, your face shields, your masks, you know how this thing is. So please take the fear out of your mind first of all. If we will look after the patient, there is no patient family attendant who is available to take care of the patient. You are the only one who is available. Sent by God, maybe. Have to be strong. You have to be that way that I need to keep this patient. I need to give the medicines on time. Otherwise, with my fault, I will lose a life in front of me. And that guilt will let us survive. That will bless us. Yes. So that is the factor that we need to control the fear of contracting the illness. We are taking all the necessary precautions. We are using sanitizers. We have, till date we are getting the at least the essential supplies of the ultimate suits, the N95 masks. We are not short of it. We have even heard like nurses resigning because they are being provided N95 masks. But that's not the situation here now. We are getting the things and we won't get that infection directly in us by interacting with patient. So accordingly, we need to work and control our emotions.
Thank you so much, ma'am.
Yeah, thank you, Saurav, for asking the question, and thank you, Miss Ginny, for beautifully explaining. And as she said, we have to be together here, and we have to think the patient as our family members. So together we can defeat Corona, right? So there is a fear inside us, so that we have to overcome that fear and we have to overcome that anxiety. Okay, so any other question?
Ruchika has
Yeah,
asked one
Ruchika
question.
Singh is asking. Yeah, lot of people are unable to control their surroundings due to this pandemic and fear of death. Fear of future responsibilities are creating lot of mental health issues. So how one can approach to this?
Uh, Uncertainty and anxiety of anticipation uh, is very prevalent. I understand. Thinking about the future won't help right now. We don't know this world will last for another 100 years or not. It will just be affected the present day. Of, for example, I'm working today, and my actions at this moment will affect a life in front of me, the patient. And fearing about the future, my family standing there watching a patient die won't help me to secure my future. So accordingly, we need to see everybody and take care of the urgent needs that comes in front of our eyes one by one. Prioritize the care. We cannot lose a life by just thinking about our future. we are not here into a profession where we need to be selfish. We have to think about everybody. The healthcare setup is designed in such a way that we have been trained as nurses in such a way that we really need to show concern first about others, and then we think about ourselves. So here also the same thing needs to be applied. I hope
Yeah. Thank you.
clear about okay anxiety. See, then no one who can care.
Another question just popped up. Yeah.
Hello.
Okay. Please go on. Yeah.
I'm sorry.
Sorry. Yeah.
There is nobody who can predict an end to this pandemic currently. So instead of being anxious, thinking about the future happenings, I think each one of us, whether nurses or normal people, we need to take a hold on our emotions and just live in the present and face all the challenges that are coming in our way. That will help a lot. Otherwise, this anxiety levels will keep on rising if we think or worry about the futuristic things.
Okay. Thank you, Ms. Lini. So there is another question. So Saurav is again asking, Mr. Saurav, he is telling that uh, one one instruction what instruction you will give to the student nurses for maintaining their sound mental health.
Um, Student nurses, the beginners, you have to be very strong and you have to take this as a very good challenge in front of you. Maybe before you, nobody has got this chance to work in such a situation. You have to think that if you survive through this pandemic strongly, you will be able to survive anything in this world, whether on the personal front or on the professional front. You have to be really very strong, thinking that learning all those skills which you need to apply here at this particular situation, you will be able to mold yourself more strongly to face anything that will come in front of you in future.
Thank you so much, ma'am. Such an amazing session it was.
Thank you. Thank you.
Okay. So any more questions? We can take it directly also. So if there is no more questions, so we'll just wind up. And this was the last day of our international webinar series, which we have organized on COVID-19. And I hope the participants would have learned a lot about all the various aspects and what are the challenges, what are the trepidations the nurses are facing globally. We try to get the speakers from various countries, including India, and so that we can come to know about their issues, their challenges, what they are feeling. So I hope the participants have gained a lot. So I can see in the chat box, people are writing, participants are writing. So thank you to all. So I'll conclude with giving vote of thanks to all the organizers and the Deputy Nursing Superintendent, Mr. Robin Jebati from Hospital, Mulana, Nursing Superintendent, Ms. Parveen Rani from Hospital, Mulana, and our chief patron and Ms. Kumkum Ghosh of she was a nursing deputy GM, nursing education and quality, Pan Max Hospital. And so I would like to thank all the organizer and including Ms. Kusum Roy. She is a faculty in the British College of Nursing. And thank you all of the participants who have joined us and who have that willingness to learn and gain it. So we'll close this session here only. And regarding your certificate, so we'll send your certificate, e-certificates online to your emails within next 10 days. And you need to also fill the feedback form, which we'll be sending you to the emails. And once you fill the form, feedback form, it will be submitted. So we'll send your certificates on your mail itself. So any questions?
Aman ma'am,
regarding yes,
I also want to thank Miss
yes,
Ginny
Mr.
for joining us for this
Yeah,
webinar.
sure.
Thank you. Thank you so much for having me. I really enjoyed it. Hope my message makes a difference to at least some people.
Yeah, it is. It was really a great session. You have explained each and every point very nicely. And we have learned many things, whatever tactics we can use to tackle this pandemic situation. Is very useful it was. And everyone, I think it was useful for each and every person who has joined us for this webinar. And I'm thanking you again. Thanks a lot to be with us. Really thankful to you.
Thank you for believing in me. Thank you. Thank you.
So we can if any of the participant wants to give a online feedback, direct feedback also, you can just unmute and turn on your camera and you can give the feedback about the webinar series and how you felt and what you learned. Did you like it? And how we can improve further.
Uh, Aman ma'am, I want
Anybody
to give
wants
a
to give
feedback.
direct
Yes.
feedback? Okay, yeah, please
Uh,
go on.
from day 1 to day 7, I enjoyed a lot. I gained lot of knowledge from these webinars. Thanks to Kusum ma'am, Aman ma'am, and Robin sir for organizing such a sessions. It was totally amazing. Literally, it was very amazing sessions. And in the pandemic, when we all are depressed, we got lot of knowledge from this. Please organize more and more sessions like this.
So you are interested to attend.
Yes, ma'am. Always.
Okay, that's great. We are happy to know that. We are really glad that it is somewhere useful for you. Over to you, Aman ma'am.
Yeah, thank you, Mr. Saurabh, and we are happy that you learned. And thank you to all. And we please give your useful feedback and valuable feedback on the emails. We'll send you the feedback form. And thank you. We'll wind up once again. I think Mr. Robin is here. So, sir, you want to say a few words to our participants? Would you like to say a few words and just the ending remarks? Robin, sir? I think he's not able to connect. So we'll wind up here. Anyways, thank you everyone. Thank you to the organizers. Thank you to our speakers who have spared time globally and from their busy schedules, and they have that willingness to teach our participants and our participants who had willingness to learn. Thank you everyone.